I'm Stella Whitney-West, and I am the CEO of NorthPoint Health and Wellness Center. We start off with our mission, and our mission is partnering to create a healthier community, and certainly our partnership is with the community, with our staff.
My name is Xiong, and I am an OB nurse at NorthPoint Health and Wellness Center. The work that I do in general, especially with our OB population, is that we have a care coordination department, services that will help them to get to their medical appointments. If they need services downtown, we can have the transportation through our vouchers to help them with that. If they have like a child who comes here to NorthPoint and they need to get here, we also provide them help and services. We also schedule the appointments for them so they don't have to worry about waiting for long appointment calls to get in. So we work not just with them, but also with the whole family, so that's one less barrier for that mom. When you work with somebody like that, it's very special and meaningful. Like for example, for our Hmong patients, they know that we come from the same background and they know the life struggles and what we go through. And when we make these appointments, they know that family is very important. And how do we work around with them and get them the medical services that they need, but at the same time deal with what else is going on at home as a whole. And so we as care coordinators is very unique because no one has that I've seen. That NorthPoint is unique in that.
My name is Peggy Moore, and I am the Community Health Worker Program Coordinator for NorthPoint. NorthPoint is so diverse, and we are in the community. We're doing all kinds of outreaches in the community to educate and to make sure that we have events and include the community. Having different resources and different programs, not just medical, but we have human services for food, for housing, support groups for all different ages, mothers that are expecting. So NorthPoint is always getting the word out, whether it's radio, whether it's just in the community at outreaches. We connect with partners and we make sure that we're engaged.
My name is Alcocer, and I'm the supervisor for the interpreter services and transportation, a position that has shaped my life, the professional and personal. The healthcare system is complicated. It's complicated for anybody who actually do speak the language, and you try to understand the parcel and the billing area, or try to understand what type of coverage you actually have and for the medical insurance. And you constantly be on the phone, try to figure it out. You're actually able to go to one place or another, and when everything comes to you and one huge bill, you try to understand like what happened. I only went for a ear checkup, and what is all of this about? So understanding that part for our patients is very important, and I think is the communication. The interpreters help to navigate the healthcare system is very important.
We are a community legacy. We have generations of families who have been served here, and they're very proud of that. And we love hearing the stories from the community of how their family has been taken care of by Pilot City, NorthPoint. The Stronger Together campaign is really the community campaign. In our Stronger Together campaign, there are really 6 areas that we are focused on in terms of funding with this campaign. Our dental specialty services, we have an outstanding dental clinic, and one of the areas that we want to grow is the pediatrics, and also to have services for those who have mobility issues. Our food shelf distribution, continually to provide the excellent, creative, innovative ways that we are able to have access to food. Our bistro Café, and then our teaching kitchen. We know that food is medicine, and we know that making sure that our families have access to healthy foods and know how to prepare those healthy foods require that we have a space. So the teaching kitchen is extremely important for that. And then the drop-in child care wellness center, so that again, families, parents can come, make sure that they are able to have their appointments as well as appointments for their children without having to be worried about child care. They know that they can bring their children here. And then health equity programming, we have models of, I call them our cultural care models, where we have really developed models that work with the different cultures that we serve here. Our Hmong culture, our African American culture, and our Latino culture, our LGBTQI culture as well. We know these models work. What's important is that we have a space, so we do in our conference center, where we can then provide the training and access to others, providers, so that they know that these models work and we want other people to be able to use them. So that's important. And then having a place for spiritual healing and wellness. I mean, a person's spirituality is connected to their healing and their health, and there needs to be a space where people can make that connection, not only for our guests and our patients, but for our staff as well.
My name is Peggy Moore, and I support the Stronger Together campaign.
Mi nombre es Samuel Alcocer y apoyo la campaña de Stronger Together.
Kulumbeya dia Xiong, Gutsonga, the Stronger Together campaign.
My name is Stella Whitney-West, and I support the Stronger Together campaign with every fiber of my being. I support it.